Welcome to Lifestyle Matters. I'm Marilyn Moore. It is the year of 2020, which means we need to be achieving 2020 vision, obviously. We only get one set of eyes, so we need to be taking care of them. And what better year to remind us than 2020? We've got Dr. Waldrop here from IQ Vision Care to be talking to us about our vision this year. Doctor, thanks for joining us.
Thank you. Thank you for having me.
I'm happy to be here. So tell us about, this year, what makes it so special?
Well, obviously, 2020, it's the only time it's ever going to happen in history, and it goes so well with ophthalmology that we just think it's a great opportunity to kind of remind people about their eyes and remind people about eye health and that they need to get their eyes checked, and we're the place that we want to be there to provide it for them.
I know when 2020 hit, I immediately thought, oh my goodness, when was the last time I got an eye exam? And I think it's been a while, so don't worry, I'll be coming in. Yeah. Why don't you tell us about IQ? What kind of services do you offer here?
Sure. So IQ, we've been part of the Valley for over 60 years. We have the complete range of eye services, anywhere from kids to adults. We do basic eye exams. We do complex surgeries. We really have the whole gamut. We've got specialists, we have subspecialists, we have general eye care providers. So we're really lucky. We put together a very strong team of optometrists and medical doctors and surgeons, and we all kind of work together with our real goal being to give patients the best care that they can.
I feel like you really have like a continuum of care. Can you maybe expand on that? I feel like you come here for an eye exam, but you don't just leave after that.
Right. Yeah. No, we're really lucky. So we have from the beginning with the eye exams, we can go all the way up to doing surgery. We have our own surgery center here in this building here in Fresno. And so really we like people to know that if you come here, we're going to be able to give you care from the beginning to the end, and it's very high quality care. I'm so proud of the doctors that we have. I'm very proud of the staff that's here. They're specialized. They really work on these things. We see thousands of patients every month, and we really hope that all that experience has made us very focused and very expert in our fields of what we can provide to people.
Would you say when patients come here, it's really, you become family?
Yeah, I mean, we want them to feel that we care about them because we do care about them, and we also want them to recognize that this is a very professional place, and we want them to not only feel like family but feel very well taken care of. And it's not just here in the Fresno office. We have our Clovis office, which we've been out there at least 6 years now, and we work closely with Clovis Community Hospital, and that's been a great connection. And a lot of people don't realize we have an office down in Selma, and it's been down there the new building's been down there for 15 years. So we love to provide care to the South Valley, and we've really been growing over the time we've been here.
I know you guys are wonderful. I've been here many times interviewing all the different doctors you have on staff, and you guys are all great. What about eye exams? How often should somebody be coming in? Right.
So there are a couple of variables to that. The biggest one is basically once a year you should be getting your eyes checked if you have any medical conditions. For example, if you have diabetes or high blood pressure, if there's a family history of glaucoma. Those are situations, or someone you've been told that you might be a glaucoma suspect. Those are people every year. People who have otherwise, I would say every 2 years at a minimum is how often you should be checked. Some insurances won't allow exams more often than that, but that's something that we should be part of.
I'm always curious, are people coming in more, because I know 2020 obviously I think is the year of eye care, but what about technology? I feel like everyone's on their phones. I know I deal with a lot of eye strain. Is that something that can be maybe diagnosed when you're here?
Absolutely, and we actually see a lot more problems with, they talk about the blue light, and they talk about when you're on your screen so much, you don't blink as much, and dry eyes can become a much bigger problem than it used to be. So we have a clinic that's specifically devoted to dry eyes, and there are newer medications that weren't available even a couple of years ago that can help people with dry eyes, that can help people with eye strain. So there are new things, and that's, again, one of the reasons we need people to come back in and just kind of get checked, because things may have changed since you had your last eye exam, and we'd love to go over it with you.
And you also have a full eyeglass store as well.
We have a complete range of glasses that can come from a lot of different places, from very high-end glasses to ones that are more affordable in some of those situations. So it's great. We have glasses here. We have glasses in our Clovis office. We have glasses in our Selma office. And we also have non-eyewear related things that are fun, the things that I kind of specialize in, some of the Botox and fillers and skincare. So that's something else that people don't realize, that we have a med spa here at IQ. They think so much of the eyes, and of course that is the bulk of what we do, but we have this nice extra boutique that is really a nice extra for some of our patients.
I love that. You can get 20/20 vision and then you can get rid of those crow's feet, right?
Yeah, absolutely. We love doing that, and it's very common. It's not uncommon that after people have gotten their cataract surgery and they don't need glasses anymore, they're like, oh, where did this come from? And so then they just send them over and we work on that.
Like I said, a full continuum of care, not only fixing the eyes, but you could fix that pretty face.
Yeah, absolutely. We really enjoy it. And I've been here 16 years, and it's really been a very enjoyable part of my practice.
I was going to say, you don't look that old. Gosh, 16 years, that's a long time. Congrats. Well, viewers, that's all the time that we have. We've been at IQ Vision Care. You can go book an appointment online, give them a call. Thanks for tuning in. I'm Marilyn Moore, and we'll see you next time.